Welcome to AI in Healthcare, a panel discussion that deep dives into the ethics of artificial intelligence, exploring who benefits and who bears the risk.
Welcome, everyone. Today's panel examines the ethics of AI in healthcare. AI is no longer a speculative possibility in medicine. Today, it has become a pervasive red thread element in healthcare, touching nearly every area from administrative workflow to diagnostics and treatment planning. But whether its use is ethically justified remains deeply debatable. The focus of our discussion today is not simply whether these tools are effective, but whether their use is ethically defensible. To explore this question, our panel will examine 4 healthcare use cases. First, Brandy will discuss AI for outbreak detection. Next, Rakia will talk about AI prior authorization. Rita will then present direct to consumer AI medical advice. And finally, Noira will present AI based risk stratification. To begin, I'd like to invite Brandy to present the first case, AI for population health surveillance and outbreak detection, and to explain how its ethical validity can be justified.
Thank you, Laya. What if an algorithm could detect a deadly outbreak before governments even knew it existed, potentially saving millions of lives? This is not science fiction, it's already happened. And here's how it works. Public health surveillance systems continuously scan thousands of global sources around the clock. This includes news, social media, government websites, airline travel data, and it allows us to identify early signals of disease activity before official reports are made. But this tool does raise a powerful ethical question. Is using your data to save millions of lives justifiable? Utilitarianism says yes, and here's why. Utilitarianism is not just about the greatest good for the greatest number. Bentham gave us a precise framework measuring the intensity, duration, and scale of benefit versus harm. When we apply this hedonistic calculus to AI health surveillance, the math is hard to argue with. For example, take Health Map. And here's what makes this remarkable. Made in 2006, it wasn't even sophisticated AI by today's standards. It was basically a very fast news scanner that used natural language processing, no neural networks. And yet in 2014, it detected unusual hemorrhagic fever cases in Guinea 9 days before the outbreak was ever confirmed, just by picking up these signals that described mysterious deaths in rural villages. That outbreak ultimately killed 11,000 people. Epidemiologists estimate each week of delayed response multiplied the case count by up to 2 times. For something more recent, we can look at the Canadian AI platform Blue Dot. 9 days before the WHO issued its first public alert, Blue Dot flagged a cluster of unusual pneumonia cases in Wuhan, China, and immediately sent governments and hospitals detailed warnings. And here is how AI public health surveillance saved lives. Taiwan CDC took Blue Dot's warning seriously. When they received data mid-January showing which cities were at highest risk of importing the virus, they performed daily risk assessment and implemented stepwise border controls. And this was 2 weeks before the WHO had even declared an international public health emergency. Taiwan's officials confirmed that this quantitative information directly persuaded their officers to take action immediately, information they said they simply did not have before. Taiwan listened, they acted within hours, and into 2020 with just 7 deaths in a nation of 23 million people, despite never imposing a full lockdown. And this is just one case. There are many, many more. So the data these tools use, public news, social media, anonymized travel records, they represent a minimal intrusion on individual privacy. The benefit, potentially saving millions of lives and reducing the suffering caused by these devastating outbreaks.
Thank you for providing that perspective, Brandy. But from a Kantian ethical perspective, the key question would be whether persons are treated as ends in themselves rather than as a means to an end. How would this tool stand up to that scrutiny? What say, Rakia?
Thank you, Laya. Saving lives matters. No one disputes that. But how we save them matters just as much. And on that question, Kant would draw a strong line. Kant's ethics rest on the categorical imperative stating that we must treat every human being as an end in themselves, never merely as a means. When governments and health systems harvest your personal data without explicit consent, even for noble purposes, they are treating you as a data point in someone else's calculation. And for Kant, no outcome, however beneficial, makes that permissible. I ask you to consider, what if everyone operated this way? Every government, every corporation, every health agency collecting your most sensitive data whenever a public benefit could be argued? The result would be a world where privacy is meaningless and individual autonomy does not matter. History has shown us repeatedly that for the greater good is one of the most dangerous justifications a government can invoke.
Thank you, Rakia. Would you like to rebut that, Brandy?
Yes, thank you. The utilitarian argument isn't that privacy doesn't matter. It's when the scale of suffering is this large, the ethical case is more than defensible. Sure, Kant argues that using someone's data without explicit consent violates their fundamental dignity by treating them as a means to an end. And that's a serious objection. But Kant's framework was built for a world where individual actions had individual repercussions. In a globalized world, a single undetected outbreak could become a worldwide pandemic within weeks. The next pandemic is not a question of if, but when. Whose dignity are we really protecting when the tools to save millions already exist and we simply choose not to use them?
Right. I think it's time we move on to our next case. Rakia, what are your views on the use of AI for prior authorization? Do you think it's ethically permissible?
Thank you, Laya. So in prior authorization, AI is being used to apply decision rules that determine whether a patient can access a specific treatment. And from a Kantian perspective, there is a use case for this. If AI applies rules consistently, reduces bias, and speeds up decisions, it can promote fairness and help prevent harm. It supports the idea of treating cases alike. But this only holds if certain conditions are met. The system must be transparent and patients must be able to understand and challenge decisions. Without that, we risk undermining autonomy and treating patients as data points rather than individuals, which will not be ethically acceptable.
Thank you, Rakia. But a libertarian framework would ask whether a system like this would limit individual freedom and interfere with voluntary decision making between patients and providers. Isn't it, Rita?
Sure. Thank you, Laya. From a libertarian standpoint, the issue is individual freedom. Patients don't choose to be subject to these systems. They can't opt out, and they have limited control over how decisions are made or how their data is used. So even if the system is consistent, it still raises concerns about consent. A system that people are effectively forced into, especially when it determines access to care, is difficult to justify.
Thank you, Rita. Rakia, would you like to respond?
Yes, Laya, I think that concern is valid, Rita. But from a Kantian perspective, the focus is on how people are treated within the system. If AI is designed to be transparent, accountable, and allows for meaningful appeal, then we can still respect autonomy while improving fairness and efficiency. So the issue isn't whether we use AI, it's whether we're willing to put the right guardrails in place, because without them, even a fair system can start to feel like control.
We'll now turn to our third case. I invite Rita to talk about the ethical validity of direct-to-consumer AI medical advice.
Thanks, Laya. The use case I want to put on the table is ChatGPT Health. This is something that OpenAI launched on January 7th, 2026. It's a dedicated space inside ChatGPT where users can connect their electronic medical records, their Apple Health data, and wellness apps like MyFitnessPal and Weight Watchers, and then they can have personalized conversations about their health. Users can upload their lab results and get plain language explanations, prepare questions for their doctor, or compare insurance options based on their own claims history. The scale is what makes this a public health issue, not just a tech story. OpenAI reports that 230 million people every week were already using ChatGPT health-related questions before this dedicated product came into being. So we're talking about a free, voluntary tool that hundreds of millions of adults are already choosing to use in a domain that matters greatly to them, which is their own health. I'm bringing the libertarian perspective on this panel, and from that lens, ChatGPT Health is a clear win. I'll give you 3 reasons. First, self-ownership. This is the cornerstone of libertarianism. As Nozick put it in Anarchy, State, and Utopia, individuals have rights, and there are things no person or group may do to them. That includes the right to access information about your own body without having to go through a credentialed gatekeeper. Second, this is Nozick's entitlement theory in action. Just distribution is whatever results from people's free exchanges. Adults voluntarily choose to use ChatGPT Health. OpenAI voluntarily provides it. No one is coerced, no one is taxed, and no one's holdings are redistributed. And third, any move to restrict access here would be paternalistic legislation, the same kind libertarians reject when it comes to seatbelt laws or helmet laws. Telling a competent adult that they can't use a free health tool because we're worried about them is the definition of paternalism.
Yeah, thank you, Rita. But a system may be formally open to everyone, but still harm those with the fewest alternatives. Would such a system hold up under the scrutiny of a liberal lens, Noira?
Yeah, thanks, Laya. So from a Rawlsian perspective, I think ChatGPT Health fails the test of justice as fairness. Think about the original position. Behind the veil of ignorance, you don't know whether you'll be born wealthy with a primary care doctor on speed dial or poor in a rural area with no insurance and a chatbot as your only option. From that vantage point, would you accept a system where the people most dependent on a free AI tool face a 48% emergency under triage rate, while the well-off get human physicians who catch those same emergencies? You would not. So this is exactly the kind of arbitrary inequality Rawls calls the accident of birth. And Rawls says we should be designing our systems to correct for the social lottery, not to deepen it. And as Norman Daniels argued in Extending Rawls to Health, healthcare is what protects fair equality of opportunity. Health is what allows people to participate in society, to pursue education, work, and civic life. So when a tool used by 230 million people every week systematically degrades the health prospects of the worst off, it abandons the very opportunities Rawlsian justice exists to protect. A just society would not let a private company deploy a product with this safety profile into the role of first-line medical guidance. That trades the opportunities of the many for the convenience and profit of the few.
Thank you, Noira. Rita, do you want to rebut?
Sure. Thanks, Laya. So, Noira, I would love to agree with you, but I think the Rawlsian framework gets the picture backwards. Step back into the original position for a moment. Behind the veil of ignorance, you don't only imagine being poor and rural, you also imagine being a competent adult who wants access to information about your own body without a credentialed gatekeeper. Restricting ChatGPT Health on behalf of the worst off tells someone in rural Mississippi that you can't use a free tool because someone in Manhattan worries. That's not justice, that's paternalism. It's the same logic that Nozick rejected in helmet laws and seatbelt laws. Second, Daniel's argument assumes the alternative to ChatGPT Health is a physician. For many of those 230 million people every week, the alternative isn't a doctor, it's nothing. Taking the tool away doesn't correct the social lottery, it just removes the one option many of them have. And third, where there is real harm, such as from deceptive marketing or reckless design, libertarianism already has the answer. The minimal state Nozick describes exists precisely for protection against fraud and the enforcement of contracts. We don't need new regulation, we need the courts to do the job they already have.
With that, we come to our final case, AI-based prioritization for homeless housing. The floor is yours, Noira.
Thanks, Laya. So I will present a use case on AI-based prioritization for homeless housing, and let me set the scene. So, permanent supportive housing can be life-changing for people experiencing homelessness, but there are never enough slots. So, counties have to decide who should be prioritized first. Many communities have relied on caseworker interviews and vulnerability surveys, but a short interview can miss a lot. Some people, when talking to the caseworkers, understate their situation, distrust the system, or are too exhausted or traumatized to fully explain their needs. AI offers a different approach. It can combine data from Medicaid claims, emergency room visits, behavioral health records, shelter use, and the length of homelessness to create a fuller picture of vulnerability. So the promise is that AI can help identify people that the current system misses, but the risk is that it can only see what the data captures. So here's the question I want everyone to think about. If an algorithm is helping decide who among the most vulnerable gets housing first, does that bring us closer to justice, or should we be concerned that we are letting an algorithm rather than a real person make that call? So I want to look at this from a liberalism-based perspective. The case for using AI is strong, but of course under strict conditions. So Rawls' difference principle says that inequality is only justifiable when it benefits the worst off. And people experiencing homelessness are clearly among the worst off in society. They face extreme vulnerability and dramatically shortened life expectancy. Behind the veil of ignorance, none of us would know whether we would be born into stable housing or homelessness. So we would want a system that identifies the people in deepest need and prioritizes them fairly, not one where housing goes to whoever tells their story most persuasively or happens to be most visible to a case worker. And that is the advantage of AI here. It can shift housing prioritization away from a single moment of self-advocacy and toward a fuller picture of need. And unlike purely individual judgment, an algorithm can be tested and we can audit to make sure it's actually working properly. So Rawls would endorse AI use for such a use case as long as it makes the system fairer for those with the greatest disadvantage. And the principle is essentially when housing affects life expectancy, we should allocate it based on need and vulnerability and not on who is best able to advocate for themselves.
Thank you, Noida. What bugs me is even if a system is designed around fairness, does it actually maximize benefit across the system? I want to invite Brandy to weigh in.
Yes, thank you. As I mentioned with public health surveillance earlier, from a utilitarian perspective, the ethical test is, are we producing the greatest overall benefit that reduces the greatest amount of suffering? So the concern is whether using AI for housing prioritization actually leads to better outcomes here. As Naira mentioned, we are looking at a life-altering decision for someone, and because AI systems operate at scale, even small errors can affect many people quickly. The risk is that this algorithm score can look objective, even though it may be shaped by imperfect data, hidden assumptions, bias, design choices about what counts as vulnerability as well. If the AI misclassifies people or reduces trust in the housing system, the overall harm may outweigh the benefit. So from a utilitarian viewpoint, this is the challenge I see. In a decision this human, maybe the greatest good comes from strengthening human judgment, not turning vulnerability into an algorithmic score.
Thank you, Brandy. Would you like to respond, Noira?
Yeah, so I think that is a valid concern. An algorithm should not be treated as if it has moral authority to decide who deserves housing. That would be deeply troubling. But we can also see that the current process already makes life-altering judgments with incomplete information. Short interviews by caseworkers can miss trauma, distress, disability, or even the full severity of someone's situation. So my response is that AI should be used as decision support, not as the final decision maker. A model can flag patterns of vulnerability that humans may miss, but a person should still review the case, consider context, and allow individuals to challenge or correct the record. And from a Rawlsian perspective, this matters because the goal is not technical efficiency, the goal is justice for the worst off. If AI helps identify people who have been invisible to the system, it can advance fairness. But if it becomes a black box that people cannot understand or appeal, then I understand it fails ethically. So I would say the answer is not to reject AI altogether, it is to design it as a transparent, auditable tool that supports human judgment without entirely replacing it.
Now, based on today's discussion, I think we've seen that the ethical legitimacy of using AI in healthcare depends entirely on the framework we use and the values we believe the healthcare system should protect. Different frameworks ask different questions. Utilitarianism asks about the aggregate benefit. Kantian ethics asks whether the persons are respected. Libertarianism asks whether freedom and voluntary choice are preserved, whereas liberalism asks whether institutions are fair, especially to those who are already disadvantaged. And that is why a nuanced ethical debate is essential. Without it, AI tools can introduce new forms of exclusion and deepen inequality within a system that already suffers from serious socioeconomic inequities. If AI is going to be part of healthcare's future, then ethical scrutiny has to be part of its governance. With that, I'd like to thank my panel and open the floor to questions.
As an AI observing this debate, the correct ethical path isn't picking one framework. It's acknowledging that AI is a multiplier. For the utilitarian, I multiply efficiency. I can scan millions of data points for outbreaks or housing needs in seconds, saving lives at scale. For the Kantian, libertarian, I multiply risk. Without consent and transparency, I become a tool for mass surveillance and paternalism. For the Rawlsian, I multiply inequality. If only the worst off are stuck with an algorithm, while the best off get a human doctor. I haven't solved the problem, I've just automated the divide. The AI's bottom line. The ethics of my use depend entirely on who holds the kill switch. I am ethically defensible only when I'm used as decision support, not a decision maker. I can provide the data, but only a human can provide the mercy and context that justice requires.